I'm Mercedes, and I'm going to be doing an RN IV push med skill. So my situation is I have a patient that just received a unit of RBCs, and upon assessment, we found that he had crackles in his lungs and he had increased shortness of breath. So within speaking to his provider, the doctor, he ordered 40 milligrams of Lasix, and what I have on hand in the vial is we have 10 milligrams per mil. So what I'm going to have to administer is 4 mils to the patient for the correct dosage after my math calculations. And I'm going to be this medication for the administration time, you push it over 1 to 2 minutes. In this skill, I'm going to approximate 1 mil every 30 seconds. That'll be totaling 4 mils. Even before coming in this patient's room, I'm going to check his allergies and verify that he is not allergic to this medication. I've gathered my supplies and I'm ready to enter the room. Knock, knock, knock. Hello, Mr. T. Igger. How are you today? Good. I'm Mercedes, and I'm going to be giving you some medication that the doctor ordered. So can you verify your name and date of birth? Thank you. And I have a band here. As I'm working on my computer, I can scan his wristband and make sure that his number matches my computer. And explain the procedure, kind of like I did. So this is the line that his red blood cells is in, but we'll actually be using a different peripheral access line for the medication. So I'll come over and I have a little watch here for my clock. So I'll stop the IV, temporarily pause it, and then I'll proceed. So I will wash my hands and put my gloves on. This is not a sterile procedure, so you would not need sterile gloves, but for this video purpose, this is what I had on hand. Okay, so first, these are a little big, I apologize. So first, I'm going to go ahead and scrub the hub for at least 15 seconds. Okay. So first, I do a flush. It'll be 10 mils, and it does not matter how much time allotted. There's no time for this, so I can just flush it. For an actual skill, you will have a connector that will turn onto this and secure properly. But for this video, I'm going to be injecting into this bowl here. And if you noticed, I am going to keep this line clamped. So nothing can run back up into the IV line where our solution would be coming from. So I'll give this push. I'm going to aspirate. So I'll make sure that there's no air. Aspirate, pull back a little bit just to see some blood return. And then I will flush. And this is to basically ensure patency. Next, I will have my medication. I have 4 mils here, and this is a perfect example of how these would connect. But again, I'll be injecting into this bowl here, and this is the one I need to time. So I will start at the 3, and right now, ready for a meal. "15 seconds, so we'll have half a mil approximately left. And 30 seconds. And 30. And 15. And 30. And now for my second flush, I will be doing the first 4 mils. Oof, if I can get this off here. Be ensuring that I don't get the hub dirty. If I were to, I would obviously clean it again. I apologize for the difficulty here. Okay. You would never actually do that, but in this time, I had to do that. They would not come off. So make sure there's no air bubbles here, and I have 10 mils. And this, again, I would put on the hub. And the first 4 mils, I'm gonna do over 2 minutes. And I will start now. So that's 30 seconds. And another 30 here now. And 15. And 30. And 30, which brings us to the 2-minute mark. So now I can just go ahead and we will flush the rest. And I can restart his IV line of normal saline. I will educate the patient on what to kind of look for in the process. I'll remove my gloves, wash my hands, ask him if he has any questions, and we will be continuing to monitor him and listening to the lungs especially. We'll monitor INO. And if he doesn't have any other questions and doesn't need anything else from me, I will give him his call light and I will exit the room. Once I've come back out here, some facilities you can chart right in the room, others you will chart outside. So I'll just say what I did, how much I administered of the Lasix, and that everything went well. And so we'll continue to monitor. And that is the end of my skill.